Today I will just talk about the liver, the gallbladder, and the gallstones because a lot of people are coming with the complaints about bloating, indigestions, a lot of problems with the food which is not digestive. It's very difficult to find out certain things, not simply giving some kind of antacids or kind of digestive enzymes. No, we should really go into the root of the causes which causing the problems. So that's why today I am talking about gallstones in the liver. The liver is the largest gland in the body. It's weighing up to 3 pounds. It is suspended behind the ribs on the upper right side of the abdomen and spans almost the entire width of the body. The liver is an extremely active organ that has to perform hundreds of different functions with its dazzlingly intricate labyrinth of special cells, veins, and its ducts. It resembles an entire city for the variety of its activities. Because the liver is responsible for processing, converting, distributing, and maintaining the body's fuel that supplies energy and nutrients, it directly affects the health and vitality of every cell in the body. The liver also influences the secretion of digestive enzymes and produces many hormones that affect the way the body functions, grows, and heals. It makes new amino acids that converts the existing ones into proteins, which serves as a building blocks for the cells, hormones, neurotransmitters, genes, etc. This vital organ, the liver, also breaks down the old cells and recycles the iron. It stores blood and important vitamins and nutrients. Apart from breaking down the alcohol, the liver makes powerful enzymes that detoxify the noxious substances like bacteria, parasites, and certain drug compounds. All in all, it filters more than a quart of the blood each minute. The liver keeps the body warm, provides the energy for sexual performance, and maintains good eyesight and keeps the mind clear and efficient. One of the liver's most important function is to produce bile, about 1.5 quart per day. Bile is viscous yellowish green fluid that is in alkaline property versus acidic and has a bitter taste. Most of the food cannot be properly digested without bile. For example, to enable the small intestine to absorb fat and calcium from the blood, what you eat, the food must first mix with bile. When the fat is not absorbed properly, it indicates that the bile secretion is insufficient. The undigested fat remains in the intestinal tract. When the fat reaches the colon, along with the other waste products, the bacteria breaks down some part of it into the fatty acid components, or else it is excreted with the stool. Since the fat is lighter than water, it may make the stools to float. If fat is not absorbed, then calcium is not absorbed, either leaving the blood in a deficit. The blood subsequently takes an extra calcium from the bones. Most of the bone density problems actually rise from the insufficient bile secretion and poor digestion of fat rather than from not eating enough calcium. Apart from breaking down the fats containing in our food, bile also removes toxins from the liver. One of the lesser known extremely important function of bile is to deacidify and cleanse the intestines. If gallstones in the liver or the gallbladder are critically impeded, the bile flow, The color of the stool may be tan, orange yellow or pale as like a clay instead of the normal greenish brown. The gallstones are the outcome of an unhealthy diet and an unhealthy lifestyle. If gallstones are still present in the liver even after other disease causing factors are eliminated, they still pose a considerable health risk and may lead to illness and the premature aging. For this reason, the subject of gallstones has been included in the talk because of the major risk factors of causing disease. The following things what I am going to talk is what are the consequences that a gallstone in the liver have a different organs and systems in the body. By removing these stones, the body as a whole is able to receive normally healthy and healthy activities. When your liver's bile duct become obstructed, the most common but rarely recognized health problem today is blockage of the liver's bile duct through gallstones. The obstructed bile flow can directly and indirectly impair the functions of every part of the body and eventually lead to death. If you suffer any of the following symptoms similar, you may likely to have numerous gallstones in your liver and gallbladder. Few I will just explain, which is like low appetite, food craving, digestive disorder, diarrhea, constipation, clay colored stool, hernia, flatulence, hemorrhoids, dull pain in the right side, difficulty in breathing, liver cirrhosis, hepatitis, host infections, high cholesterol, heart disease, brain disorders, duodenal ulcers, nausea and vomiting, a bilious or an angry personality, depression, impotence, lot of sexual problems, prostate disease, urinary problems, hormonal problems, and so on. A lot of lists. Any of these problems, if you are be suffering, really understand that there is a problem with a flow of bile to the intestines. If it is obstructed, it can cause us a lot of conditions normally we face in our daily life that has to be corrected with the liver and the flow of the bile. Persons suffering from chronic illnesses have hundreds, if not thousands of gallstones are congesting the bile duct of the liver and the gallbladder. The liver is able to return to its natural efficiency once the stones has been removed through a series of programs of liver cleanses and by maintaining a healthy diet and lifestyle. If not all the symptoms, discomfort of the body will soon begin to subside and many allergies will disappear. The back pain will come to an end and energy and well-being will improve dramatically. In my experience, the cleansing program, the liver bile ducts and the gallstone is one of the most important powerful means to improve your physical, mental and spiritual health. Second thing, I am just talking about gallstones. It's a constant source of disease. Gallstones in the bile duct of the liver, medically known as intrahepatic stones, consists of mostly the cholesterol, 60 to 90%. The rest is made up of bile constituents as well as the toxins, bacteria and parasites. Relatively few are made up of organic matter from the food. They are invisible to normal X-rays because they are not calcified. The gallbladder have a larger stones that are calcified and can be detected. Even in the ultrasound technology can be spot non-calcified fatty deposited in the liver only if they occur in a large quantities like many thousands of stones. The diagnosis of this condition is often referred as fatty liver because it is intrahepatic. The gallstones found in the liver come in all shapes and colors. Most of them are bright and dark green, yet some others are in white, red, black or tan color. They result from the overheating and unhealthy diet and sedentary lifestyle as well as stress and repressed anger. As the stones grow in size and become more numerous to the liver cells are compelled to reduce the bile production. Normally the liver produces well over a quart of bile each day. This is reduce the amount properly digest food in the small intestine. When the major the bile ducts are blocked, barely a cup or even less will find its way to the intestinal tract. The restricted bile production does not only impair the digestion but also prevent the liver from excreting the toxins and propelling the stones out of the bile ducts. All this will affect the blood circulation in the liver and the walls of the liver's blood vessels, called as synoids, becomes increasingly clogged up. This in turn prevents the low density lipoproteins called LDL or very low density lipoprotein called VLDL or so called the bad cholesterol from leaving the bloodstream. Hence the rise in the blood serum cholesterol levels. Since the gallstones are porous, they can pick up or absorb toxins, bacteria, virus, parasites and cysts that are passed through the liver. Like fishing nets collect the fish, the stones become constant source of infection. Supply the body with an ever increasing number of fresh bacteria. The attempt to permanently cure the intestinal bloating, cystitis, candida, stomach ulcers, infectious disease or any other above conditions which I have been told you is likely to fail if the bacteria harboring gallstones are not removed from the liver. On occasion, one or the several gallstones get stuck in the cystic duct, in the vessel that links the common bile duct with the gallbladder, or in the common bile duct itself. In this case, the wall of the duct undergoes strong spasmodic contractions in order to propel the stone onwards. The contractions of the duct can be cause excruciating pain throughout the abdomen and in the back and also in the legs and the arms. When the gallbladder is packed with gallstones, this too may go extremely painful spasmodic muscle contraction, a condition known as gallbladder attack. Gallstones can trigger strong reactions of irritations and inflammation of the walls of the gallbladder and the cystic and the common bile ducts. These may be superimposed microbial infection. Today, over millions of people suffer gallbladder disease each year, and only 1 million of them opt for an expensive gallbladder operation. If a person has his gallbladder removed surgically, he may feel tremendous relief from the acute pain and the attacks. His digestion is likely to improve for a short while. This is due to comparatively more bile being available for the digestive process. But the disadvantage is, however, that the bile becomes in small trickles throughout the day rather than in the large amount when it is needed to digest a meal. Bile causes injury to the intestinal walls unless it is mixed with food. In addition, since the patient still has the stones left in the liver, the digestive troubles become most likely to return and get worse. Other existing health problems such as the pain, asthma, bursitis, heart diseases, arthritis, so on, lot of conditions become intensified as well. If gallbladder becomes stuck in the ampulla of the bile duct, where the common bile duct from the liver and the gallbladder joins the pancreatic duct, and jaundice and acute pancreatitis usually develop. This condition can eventually lead to the tumors in the pancreas and to a number of other diseases. Gallstones of any kind, in size or number, can easily and safely removed through our special liver cleansing program. The first positive effect are the commonly noticed soon after the cleanse are the pain relief and regained or enhanced energy, the vitality and the general well-being. Although this cleansing program can be done by people of any age, including children above 10 years. Many of our children today have gallstones in the liver. Most of them are not knowing. And the elderly, it is recommended to do the cleanse only after having following the general guidelines for creating a healthy body for at least 4 to 6 weeks. As it is described, I mentioning the following subjects: the colon and the kidney cleanses are ideal preparations for a liver cleanse too. During the series of this cleansing process, there are a lot of gallstones or small pea-sized green stones, hundreds of chickpea-sized dozens large stones of 2 centimeters diameter. A recent cleanse showed that my liver was completely clean. The effects of each cleanse were often dramatic and added more and more benefits to the previous one. The overall results were be the energy, vitality increase at least threefold. All the discomforts, the pain, the stiffness in the body, particularly in the neck, ceased, and the digestion elimination normalized. Speaking from my point of view, the liver cleanse is the best thing I have ever done in my practice. It is giving you the physical, mental well-being. You may wonder why the mainstream medicine is there is no medical knowledge or reference that deals with the gallstones in the liver. The reason for this extremely important missing link is the theories of the modern medicine tell you that gallstones can only be formed in the gallbladder and not in the liver. The experimental evidence supporting this theory is mainly based on taking X-rays or ultrasound scans, which can detect only few stones in the gallbladder that may have grown to a certain size and calcified, that is mineral stones. The current diagnostic tools are unable to recognize the hundreds and thousands of non-calcified, hardened bile deposited in the liver or gallstones. This missing link, the ultrasound scans can reveal fatty deposits in the liver only when there is an excessive number of oversized stones, more than like 20,000 or more. It will congesting the liver bile ducts, the fatty liver so called. So fatty liver, even the grade 1, it's a very important matter. And even if early deposits are recognized, there is no effective therapies in conventional medicine that can remove the fatty liver. The presence of gallstones in the liver can be easily be verified by anyone suffering from the chronic illness, especially the gallbladder has been removed. By performing a liver cleanse program, the body will be release plenty of non-calcified bile-coated stones. These stones are identical to the green non-calcified stones found in the surgically removed gallbladder. When cut through their middle part, both of these types of gallstones bear typical age marks similar to those seen in the cut trunks. Proper analysis will reveal their age and kinds of toxins, chemicals, bacteria that the body had or has to deal with the most. Sweeping the liver cleanse eliminates the thousands and bits of poisonous substances that have helped to form the stones and plague the thousands of liver bile ducts. Cleansing the liver bile ducts from the gallstone is one of the most important and powerful procedures to regain and improve the health. Thank you.